Dr. Boyd, thanks so much for joining us. First of all, I want to hear from you is what is compassionate care to you and why is it so crucial when it comes to cancer care?
We do here in Greenwich, as part of the Yale Smile Cancer Center, we are directly responsible for the care of the patient. And I think that means we're very close to the patient. And I think the patients really value that connection. They really find that important because I always say you can always call me whenever you need me. Being more accessible and not less is really important.
Do they understand that it is a form of compassionate care?
I don't think that they need to be told that it's compassionate care because I think they know that that's what compassion is. It's caring deeply for your patient and being there for them. At the very beginning, providing hope, which is really important. Hope is a very interesting thing. There is hope for long-term survival. There's hope for cure, which is the ultimate for many cancer patients. But there's also hope for good quality care and the importance of day-to-day caring and making sure you're there to take care of symptoms and help them through this journey. We really need to recognize that we are here to help people in a journey of uncertain duration. But I always am optimistic. One of the things, that's why I call myself the optimistic oncologist, because I can't tell people how long they're going to live. And I have patients who defy all the odds. And that's largely because, number one, nobody tells them they can't.
Tell us how your compassion impacted a patient's care.
And I have many patients who I would have sworn would not live for a year or two, have lived for many years in that setting, because you can't predict for any individual, number one, how long they're going to live. But you know what the other key is? What I treat a patient with today may not be what I treat them with 6 months from now because of the rapid growth of newer approaches and treatments.
How important is it to have that close relationship with your doctor?
Well, I think it's really essential. I think it's part of the healing. That's one of the bonds that heals patients. And if you know that your doctor cares about you and is there for you, then you feel safe. And the other thing we know for sure from many studies is that relationship assures compliance. When you know a doctor cares for you, you're much more willing to stay with their treatment, even if you're having ups and downs, and do better. Because we know, for instance, in hormone therapy for early stage breast cancer, a third of patients will stop their medicines. And there's abundant evidence that worsens their outcome. And so that relationship with the doctor, ironically, is part of the compliance. Because if you're close to them, you can feel comfortable asking them questions. They can help you with, guiding you through the ups and downs of a medicine and gain their trust and make them feel that, I know he's there for me. I'm going to stay with it.